It's not that easy getting an airplane on time into Washington, D.C. from some corners of the country. Will you have a quorum on the committee this evening?
Yes, I expect we'll have a quorum on the committee. We are tracking everybody's flights, and I think all of us are scheduled to be back in time for the 6:30 clock in. So I do expect we'll be here. I didn't have any flight delays. I know that's been an issue for some. My prayers are out for Derek Van Orden traveling across the country in the cold, but he's a Navy SEAL, so I have no doubt he'll be just fine.
Understood. Sometimes these committee hearings can get kind of chippy. I'm wondering if there's going to be a full-throated debate over policy in the Rules Committee, or if this, as Eric mentioned, is kind of a perfunctory move. Just set the rules and let's get on with it.
Well, there's always robust debate in the Rules Committee. We tend to, I guess go back and forth pretty vigorously on our policy positions. But one thing I want to make clear is the reason the Democrats shut down the government for 50 days is because they're fighting for these Obamacare premium subsidies. This is a subsidy on top of a subsidy to try to prop up a failing program, Obamacare. And these premium credits don't go to families. They don't go to hardworking families. They go to big insurance. So this is a huge loss for the Democrats, and I'm grateful to the moderate Democrats in the Senate for opening the government and stopping the pain they've inflicted on our veterans and our federal workers and SNAP recipients. Enough is enough. It was a failed experiment. I'm glad that we're going to reopen the government. House Republicans are taking the lead on that now, and we will have it open this week.
So, Congresswoman, let's stick on these Affordable Care Act premium subsidies. What is the solution down the road? Because President Trump himself has said that he's open to negotiating when it comes to health care. What's the tangible policy solution that you would support? We've heard floated that there could be a year extension with some structural changes, and we've also heard floated some completely new plans altogether.
Well, there have to be structural changes. We have some recipients who have never made a claim, and yet they are receiving, and the big insurance companies are receiving a premium for these people. So there may have to be some cost sharing, but we did have some cost sharing provisions and reductions in cost sharing in the One Big Beautiful Bill and the Working Families Tax Cut Act that House Republicans passed to the Senate. It would have resulted in a 12.7% decrease in premium costs for the American people, and Democrats in the Senate fought to have that removed. So let's understand this. We had a provision that would actually result in affordability for the American people. Democrats fought to take it out in order to stand on this line, which is benefiting only big insurance. It's a debate that's worth having. We need to make health care affordable again in the United States, and under Republican leadership, I have no doubt we will.
The President talked about this last evening when he sat down with Laura Ingraham on Fox News and even floated this idea of Trumpcare, trying to describe how this would work. Congressman, let's have our viewers and listeners listen and get your reaction.
What I want, and probably what you're alluding to, is the fact that I want, instead of going to the insurance companies, I want the money to go into an account for people where the people buy their own health insurance. It's so good. The insurance will be better. It'll cost less. Everybody's going to be happy. They're going to feel like entrepreneurs. They're actually able to go out and negotiate their own health insurance. And they can use it only for that reason. That's the beauty, only for that purpose. And if we did that, that would be so exciting. Call it Trumpcare, call it whatever you want to call it.
So first we had Romney Care, then Obamacare. Maybe we'll have Trumpcare, Congresswoman. I'm just wondering how exactly that would work. The president, clearly in an entrepreneurial spirit, again said that people could go out and negotiate their own health insurance and use it only for that reason. Does that mean each of us pick up the phone and call UNH to figure out what our rates are going to be?
Well, I can't speak precisely for the president's plan because I haven't seen it, but what I can say is that every time we have inflicted a middleman in this situation, which is precisely what Obamacare did, we have the pharmacy benefit managers and insurance companies that are making record profits at the same time that healthcare costs are going up. So Obamacare was not a health care reform program. It was a health insurance benefit program, and it has failed. So if it is giving these resources directly to the American people and cutting out the middleman, I think that has to be a step toward affordability, because all we're doing now is benefiting people in the middle, and we're taking this relationship between a doctor and a patient and we're inserting a lot of people in between this, and that's resulting in increased costs. So we need more transparency, we need lower costs, we need PBM reform. These are all conversations we're going to have, but health savings accounts are going to be part of that conversation, and I think that it's worth having, again, to make healthcare in America affordable again.
So this is a conversation about affordability, Congresswoman, and we had a new Harris poll conducted for Bloomberg News, which found that half of respondents in the October survey said the economy isn't working for them. That's up 41% in February. On the heels of last Tuesday's election wins for Democrats, is this a messaging problem for the GOP or a policy problem for the GOP, or do you not see it as a problem at this point in time?
Well, much of the provisions in the Working Families Tax Cuts Act have not taken effect. I think we will see the economy bounce back after the first of the year when most of these provisions get moving. But again, yes, we need to be focused on affordability nationwide. We need to be focused on housing and healthcare affordability. I think that's clear. I think that is a message that we can all take home. It's certainly something that we hear when we're back in the district, particularly for young adults. So we will be working on those issues. We have to have the government open to do that. It makes no sense to have us all held hostage for this big insurance giveaway that the Democrats have been fighting for 50 days. Let's get back to the work of the American people so we can actually get to the problem at hand, solving this affordability issue.
You know, while we're talking affordability, Congresswoman, just to end on this, are your constituents expecting a $2,000 tariff dividend check from the president, or is that something that Congress would have to legislate?
Well, my constituents aren't asking for tariff revenue. They are not asking for that. Honestly, when I'm home, they support President Trump and they support what he's trying to do to put the American worker first. We have seen this over and over again. By closing the border, we're increasing wages. It will take time to undo the damage done by 4 years of the Biden administration. It's not going to be overnight. We are slowly working through provisions and policies to, again, make America affordable again and safe again and secure again. And all of those things are happening under President Trump's leadership and House Republicans and Senate Republicans alongside him.